Okay, great. Good afternoon, everybody. Today is Monday, April the 27th. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I'm here with my fellow commissioners, Commissioner Ken Lawrence and Commissioner Joe Gale, Dr. Al Wong, Regional EMS Director, and Dr. Brenda Weiss, Administrator for our Office of Public Health. Since our 4/26 press release, we've had 84 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 3,683. These positive individuals are from 27 municipalities, none of which are reporting new cases. So this keeps us at 61 of 62 municipalities that are home to individuals with COVID-19. The individuals today range in age from 20 years old to 99 years old. As always, you can check our county map at mocopa.org/COVID-19 for the updated numbers by each municipality. Age brackets today, we have 9 people between 20 and 29, 6 between 30 and 39, 6 between 40 and 49, 17 between 50 and 59, 15 between 60 and 69, 11 between 70 and 79, 14 between 80 and 89, and 5 between 90 and 99. And we do have one individual that the age is not known to us. There are 40 females and 44 males. 12 are hospitalized, 9 are in isolation at home, and 63 we do not have information about. I'm also saddened to confirm that 14 more Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 220 deaths that are confirmed positive from COVID-19. 8 of those individuals died in a hospital, 6 at a residence, and none are unknown. They ranged in age from 48 years old to 94 years old. And overall, we have had 112 females and 108 males lose their life to COVID-19. The racial breakdown, 11 Asian, 2 Asian Indian, 3 Asian Korean, 27 African American or Black, 83 white, and 94 we do not have the information. Now, in terms of probable deaths, and as a reminder, this is defined as a COVID-19 death listed on the death certificate as a cause of death, but not confirmed with a lab test. We currently have 69 total probable deaths. So adding that to 220, that brings us to a total of 289. I will note also that this probable number will go up and down over time. Some of the individuals who were listed as probable deaths from COVID-19 have subsequently been confirmed by a lab test, in which case we move them over to the confirmed positive number and report it that way. I wanted to give you a better sense of the hospital bed situation here in the county. On March the 23rd, Montgomery County hospitals reported approximately 15 COVID-19 inpatients, with 4 requiring intensive care ventilation. Today, 5 weeks later, we have over 400 COVID-19 patients hospitalized and 100 COVID-19 patients requiring ventilators. And this is a pretty typical number that about 25% of the people in hospitals do end up requiring ventilation. We believe that our hospitals are at a plateau or slightly increasing with the numbers of COVID-19 inpatients. The good news is that facilities are beginning to report that they have some patients who are ready for discharge to a subacute nursing facility, but a lot of these facilities don't have the staff available to care for these individuals because of isolation and quarantine requirements and staffing requirements in those facilities. So we are seeing a little bit of a backup in terms of beds in our hospitals. And the state is now maintaining a Pennsylvania hospital data webpage that lists hospital beds by county. Currently on that site, our county has about 280 regular beds available. So just want to try to give you a better sense of what the situation is in our hospitals. We do have beds available, but it's not clear yet that we've seen the peak hospitalization numbers in our hospitals. Now I'll move over to long-term care facilities. We continue to have 89 facilities that are reporting positive cases of COVID-19 among their staff and their residents. Today's totals: 1,013 of cases in residents, 390 cases among staff, for a total of 1,403 positives. Again, as a reminder, not all of these individuals are considered Montgomery County residents, and we're just simply reporting these numbers to help you get an understanding of the significant challenge that is being faced by long-term care and other congregate care settings. 159 confirmed positive deaths of Montgomery County residents are individuals from long-term care facilities. Those are Montgomery County residents, which is 72% of our total confirmed positive deaths in the county, and 62 of the probable deaths of Montgomery County residents are also from long-term care facilities. We continue to do outreach to these facilities. Our field assessment and support team, known as the FAST team, which are teams of 2 that are going out to visit these facilities, will have made 15 visits by the end of the day today. They are consulting with these facilities on proper use of PPE, helping them talk through their infection control policies. We are recommending that they perform viral testing on every resident and every staff member, and answering any questions that they might have. We now have 12 hospitals participating as of today in our real-time medical systems monitoring. We want to thank these facilities for stepping up and participating in this project with us. This lets us pull anonymous data from these facilities just to do some predictive kind of trend tracking. And we're now starting to use this data to help guide the prioritization list for where our FAST team goes next. So the goal would be to get ahead of this, to visit facilities just as they're starting to see an uptick in cases or patients with symptoms, and get a team in there from the outset or as close to the beginning as we can to help them and assist them in any way possible. We also held a conference call today with the Pennsylvania Department of Health, several different branches within that, to make sure that they understand how serious the situation is here in Montgomery County in long-term care facilities. I remind you that it's the Pennsylvania Department of Health that licenses and regulates these facilities, and we are continuing to ask them for assistance in these facilities. Now I have a lengthy announcement from our Montgomery County Correctional Facility. Over a 48-hour period last Thursday and Friday, with the assistance of Prime Care Medical, the county tested every staff member and every inmate in Montgomery County Correctional Facility. So I'm going to share these numbers with you. We tested a total of 939 inmates. Of those 939 inmates, we have back, as of this morning, 740 test results. Of those 740 test results, we have 169 individuals that are positive. And we are awaiting test results on 199 individuals. We also tested 327 staff at the correctional facility. We tested 61 staff members of Prime Care. So in total, 388 staff that were tested between the correctional facility county staff and the prime care medical staff. We've received results back from 249 of those individuals, and we have 24 county staff that are positive for COVID-19, and we have 4 staff from prime care that are positive for COVID-19. Those 28 individuals are all at home in isolation, with one exception, which was a correctional officer who was known to be positive for a period of time now, who is currently hospitalized. Of the inmates, we now have 683 that are in quarantine as a result of this testing. As of report earlier this morning, none of those individuals are experiencing symptoms at this time. So I think these numbers really highlight the importance of testing everyone in a facility. And this is part of why we're recommending all these long-term care facilities test all their residents and all their staff. These are people that are without symptoms. We've been checking temperatures in the correctional facility twice a day now for weeks. These are not people with symptoms, and it is these asymptomatic individuals who can really contribute to substantial spread. So we are taking steps to make sure that all of these individuals are safe, properly isolated if they're positive, and quarantined if they've had direct exposure to these positive individuals. And we are hopeful by taking these actions that everyone will recover fully from COVID-19. Also earlier today, we convened a call with the President Judge, the District Attorney, the leadership in our Public Defender's Office, the leadership in our Adult Probation Office, and the warden at the correctional facility, to make sure that all of these individuals are fully aware of the situation in the correctional facility. The Public Defender's Office, Adult Probation, and the courts continue to work in a very collaborative fashion to discharge anyone who could be eligible for discharge from the correctional facility. And as I've reported on before, we have discharged well over 600 people at this point, and we have average daily commits down to 3 to 4 people per day on average. So our goal is to try to make sure that only the most serious individuals are coming into the correctional facility, those charged with violent crimes, and that individuals that can be discharged early are being discharged, while always keeping the safety of our community in mind as well. The Montgomery County Community College drive-through testing site remains open and running smoothly. And as always, we want to thank the Community College, Whitpain Township and their police department, the National Guard, and the several county departments that are providing assistance at this site. As of April the 24th, 2,047 individuals have been tested, and we have received results on 2,027 of these individuals, which is 99% of the total. 295 of these individuals are positive. So for the first 6 days, we're running about 15% positive, which is a steady rate. The appointments for tomorrow, Tuesday, will open at 8 a.m., and appointments can be made at moncopa.org/COVID-19 by clicking under the green County Testing Information button. If internet is a challenge or you don't have an email address, you can make an appointment by phone. That's done by calling 610-631-3000, and again, that opens at 8 a.m. tomorrow morning. Just a reminder, there is a waiting list system now. So if you put your name on the waiting list for tomorrow, for instance, and you don't get called, then the waiting list zeroes out at the end of the day. So you do need to call back the next day and make another appointment. All right, so we wanted to talk a little bit more about social distancing today with our own very real numbers. So we have a chart that is up on the screen here, and I'm going to walk you through it. So the blue column are the test results from the Upper Dublin testing site, which was on the Temple Ambler campus. Then we have a little break where we had no testing. Then we have this sort of orangish brownish color, which is from our current site, which has been up and running since the 16th. And you can see that we had a peak positivity rate at the Temple Ambler site, and that hit about 24% for a couple of days there. And since then, it has been coming down. So a lot of people have been commenting about, are we making any progress with this social distancing? Do we continue to need to do social distancing? Aren't all the cases in the long-term care facilities, so why do the rest of us have to comply with this guidance? So I just want to illustrate to you why continuing social distancing remains extremely, extremely important. So if you look on the right side of this graph, the black dashed line represents where we are now, and where we would project we would be. That's running about 14.5%, 15% if nothing changed. Now, that black dashed line represents an average of the last 4 days, and that's about a 14.6% positive rate. So that equals, if you take that out of the 250 about that we test every day, about 36.5 people. Now, with no social distancing at all, or any kind of mitigation measures, conservatively, one COVID positive person in a 5-day period would infect 2.5 people, which would lead to a total of 91.25 infected people 5 days from now. And if those people all happen to show up 5 days from now as part of that 250 that we were testing each day, we would see a positivity rate of 36.5%. And that's represented by the red line. So I just want to make the point that if you just went back to the way we were, which I know so many people are so anxious to do, the likelihood of us seeing a huge spike in cases over the next few weeks is, at this point, guaranteed. Now, on the flip side, with strict social distancing, a positive person in a 5-day period would infect 0.625 people. That's 0.625 people, and yes, that's less than a whole person, I know that. But the point is that with strict social distancing, a person's very unlikely to infect anybody else. So that would lead, in theory, to 22 or 23 new infections 5 days from now. And if those people all showed up for testing, part of the 250 that we test each day, we would see a decrease to a 9.1% positivity rate. And that's that green line starting to go down. So this is where we want to be. We need to continue to practice social distancing. And I'm guessing the people listening to me are not the problem. But we all saw this weekend, we had pictures sent in to us from all over the county of large numbers of people in stores. And by the way, the stores that are not practicing adequate social distancing in their stores, and we get photographic evidence of that, are getting a call from one of our solicitors. In fact, a couple of calls went out this morning. But we all have a personal responsibility here. And the only thing that's going to end this is if we each do our part. And so as we've suggested before, if you pull into a parking lot of a store that just looks packed, go to a different store. Or if you think the parking lot looks okay, but you get into the store and it's clear that they don't have the right setup to maintain social distancing, take your business elsewhere. There are so many stores in this county that are doing it right, where they've got a limit to the number of people who can come into a store at any one time. They have lines set up outside the store that are marked and 6 feet apart, and they have somebody at the door monitoring to make sure that the right number, the safe number of people are inside their store. Take your business to one of those places. Those places deserve your business. The places that are allowing just a free-for-all inside their store, they don't deserve your business. And you should take the personal responsibility to go somewhere else and support the businesses that are trying hard, that know that by doing this correctly, that is the fastest way to end this thing. That's the way that we get that green line and not that red line. And with that, I will turn over to Commissioner Gale.
Good afternoon. I hope everyone watching had a safe weekend. As of 10:30 this morning, Monday, April 27th, the Small Business Administration has resumed accepting applications for loans to help small businesses impacted by COVID-19. Last week, Congress approved and President Trump signed into law a package that replenished the Paycheck Protection Program with more than $310 billion. The Paycheck Protection Program helps businesses with under 500 employees obtain loans that can cover 8 weeks of their payroll, benefits, and other expenses. Small businesses can apply for low-interest loans for an amount of up to 2.5 times their average monthly payroll. The loans will be fully or partially forgiven if businesses show that at least 75% of the money was used to retain or rehire employees, and the rest was used to pay certain qualified expenses through June 30th, 2020. You can apply through an existing SBA 7A lender or through any FDIC-insured bank or credit union that is participating. Other regulated lenders will be available to make these loans once they are approved and enrolled in the program. You should consult with your local lender as to whether it is participating in the Paycheck Protection Program. For additional information regarding the application process related to this new round of Paycheck Protection Program, please call the Small Business Administration District Office at 610-382-3062 or go to their website, sba.gov. Again, the telephone number for the Small Business Administration District Office is 610-382-3062 or visit their website at sba.gov. Thank you for watching today, and I'll turn it back to Commissioner Arbush.
All right, happy to take questions.
So let's start in order of how you said things. So you're saying there are patients who are ready to be released from the hospital, but because of staffing issues, they're having challenges finding them places to go?
Correct.
Okay. Is there anything that can be done on that front as far as staffing, bringing in people from other areas? Or, let me rephrase it. Are steps being taken to try to staff those places?
I believe so, yeah. There's all kinds of kind of step-down type facilities all around the county, and I do think many of them are trying to enhance their staff. Remember, some of these places have staff that are ill, and everything just takes longer if you're really following good infection control procedures. So, I think they're trying to be safe and not get too overwhelmed with patients coming in. So it's just something I want the public to understand and be mindful of, because I know, and I get it, people are so anxious to get out. People are angry about this. Understandably, our business owners want to open, but when we say we're just not there yet, we're not, because our hospitals could easily get backed up because there's not an easy way to discharge certain patients. And we're, it's not clear that we're entirely at the peak yet of our hospitalizations.
The jail, none of those who tested positive in this batch were showing symptoms. Did I get that right?
That's correct. So this is why we've been emphasizing, particularly to the long-term care facilities, that it's important to test everybody. I mentioned last week that a couple of our 3-4 maybe at this point long-term care facilities voluntarily just went ahead and tested everybody and shared that information with us. And not surprisingly, there are completely asymptomatic people who are testing positive. And that has to be the case, because that's part of how this virus is spreading so quickly. I mentioned the aircraft carrier, the U.S. Theodore Roosevelt, had 4,900 sailors on it. Over 600 of those sailors tested positive, and over 350 of those sailors were asymptomatic. So this is a tricky virus, and I think particularly in these congregate care settings, you need to test everybody so that you can properly isolate people and quarantine people. and have a chance at getting on top of this thing.
It sounds like with the community-based testing site, results are coming back more quickly, but do the tests in a congregate care or prison type environment, does testing really matter if it takes that long? How effective is testing if it takes that long for the results to come back?
Yeah. So the question is, does testing really matter if it takes a while for the test results to come back? So in the perfect world, we'd have the test immediately, right? But we don't have that world, and we're not going to let the perfect be the enemy of the good. So what we did at the correctional facility last week was we tested everybody within a 48-hour period, which in total was, I think, about 1,300 people. So I just give our staff a huge shout out. Prime Care brought in extra teams just so we could get this done as quickly as possible. And because it's a 24-hour day staff, it took 48 hours to get through the entire staff. So we got everybody tested. I think the last tests were done Friday afternoon, and we got results yesterday morning. And we're hoping by the end of the day today that we'll have almost all the results. So that's pretty good, particularly in a situation where, frankly, there's not free movement in the correctional facility. So I think that's pretty good. And we're going to take definitive action based on this. And then we're considering a plan to, at some point down the road, we're not sure exactly when yet, we might actually retest the individuals that were negative, just to make sure they're still negative. Because it's possible that there's someone who was negative last week, but in those couple intervening days, maybe got it picked up from somebody. But at least we hope we've got the vast majority of people safely in isolation or quarantine, separated from those that are negative, and just keeping a real close eye on everybody.
The prison inmate obviously is different than the staff worker at a long-term care facility. And that same question of if the test results take 1, 2, 3 days to come back, and staff members, is there a false sense of security? Is it, I've heard people say that it's almost not worth testing because.
So the question is, take this scenario to a long-term care facility, and if you're testing all the staff and it takes a couple days for the result to come back, is it still worth doing? I would say it's absolutely still worth doing because on any given day, a staff member might be assigned to one unit, and then on a different day they might be assigned to a different unit. So, depending on where they've been, who they've had contact with, maybe they had a day off in between, it's still worth doing. You have to start somewhere. And given the situation in these long-term care facilities, I think they need to know. Everyone that I know about that's gone ahead and tested on their own has reported that they've had asymptomatic staff members that they now have at home in isolation. So that's just one less person who could potentially pass the virus. And as I have been saying from this podium now for 2 or 3 weeks, what we need are hundreds of thousands more rapid tests. And I will one more time call upon the President to invoke the Defense Production Act and get these tests made. Because without having immediate testing available to us for the virus, we will never be in as good a shape as we could be. And this is enormously frustrating to me. But we have the tools that we have the cards we've been dealt, and we can still make very good use of those tools and make good progress. But we need more rapid testing. Lots more.
Discharging inmates from the jail, is that a challenge with the positive tests? Are there conversations happening about how if someone is to be discharged but they're positive, what happens?
So the question is, if someone is going to be discharged from the correctional facility and they're positive, what happens? So the answer is, and we actually discussed this on the call I mentioned earlier today, if a judge has ordered that an inmate is able to be released, then they have to be released. So they are being given complete instructions, including being handed the official letter from our Office of Public Health, which documents in writing that they have tested positive and they are required by law during this public health emergency to isolate for 14 days, and they're required to sign that letter so that we have a copy of that. So the correctional facility has that letter. They'll personalize it for each inmate that might be discharged and is positive, and make sure that that loop is closed. Every prisoner that's discharged doesn't get discharged until they have a home, and this is true always, until they have a home plan, a place where they're going to consider their home. And so the staff is acutely aware of this situation and is trying to make sure that those plans are as firm as possible and as safe as possible. But if the judge orders release, they're going to be released.
It seems like that's a vector, and that could be a community that.
It is a double-edged sword for sure. But I think once a judge makes an order, that person has the right to leave. And as long as they comply with isolation, it's no riskier than anybody else. And so we're hoping by making it clear to them, giving them all the instructions, they will comply with the isolation order. Todd?
The first question is from Kevin Tierney from Bird Media. Can you clarify which positive test results are currently being counted towards the number to meet Governor Wolf's goal?
So our information, the question is, can I clarify which positive test results are being counted to meet Governor Wolf's Reopen PA plan? So it is my understanding that it is the state's, the Pennsylvania Department of Health's positive numbers for Montgomery County that are being counted toward the governor's goals. And let me just remind everybody that PADOH's numbers differ from ours. My staff spends about 2 to 3 hours every day when we get our positive list, deduplicating and confirming Montgomery County addresses for people from this county. So the numbers do differ. I know there's been a lot of questions about whether or not long-term care residents should be counted toward our meeting the governor's goal. And that is a question that I'm raising to see how they're viewing individuals that are in congregate care facilities. Are we going to count them the same? I would, though, remind everybody who's listening that those individuals do go to the hospital. Not all of them, but some of them definitely go to the hospital, so there is that hospital bed capacity issue. And then, of course, there are the staff who come to work there every day and go home to their families in the community. So it's not as if these individuals are on an island somewhere. They are part of our community. I also want to remind everybody that the Reopen PA plan has more than just a single number that we need to meet associated with it. It is going to also be looking at hospital utilization and the availability of beds and the trajectory of those beds. It's my understanding the state is looking for somewhere in the order of there being more discharges, more people going out than there are people coming in with COVID. That would be a good metric. That they want to see adequate PPE available for anyone who needs it, and that there's adequate testing and then a tracing system. So it isn't just about hitting a single number, and I would urge the public to be less focused on that single number. That number is just one piece of a much bigger approach to determining when it's safe to go from our current red status to yellow status. I also want to remind everybody that even in the yellow status, the governor will ban more than 25 people coming together for any sort of social gathering. So, there won't be widespread ability to get large groups of people together, even once we're in the yellow status.
His next question is a follow-up. He's asking, are those from long-term care facilities and prisons being counted in those numbers?
So the question, I guess, is, in our positive numbers, are we counting individuals from long-term care in prison? So the answer is, if they are a Montgomery County resident, we do count them, as long as their official residence is in Montgomery County, whether they're in a long-term care facility in Montgomery County or in Bucks County. If their official address is Mako, they get counted with us. Same thing is true for someone in the correctional facility. However, those numbers that I'm giving you today, both for our correctional facility and our long-term care facility, are not necessarily, well, they're definitely not for the long-term care facilities. I know that with certainty. I'm not 100% sure about the correctional facility. Those individuals may not all be Montgomery County residents. And there is some lag time on when the numbers are reported, because even positive tests have to be reported to the state, and then we pull them down each day in a daily report, and that is the official number that we report. So I'm giving you some sort of early look into kind of what's coming here in the county.
Mr. Tierney also asked, do you think focusing on these metrics to reopen could discourage people with symptoms from seeking a test?
So the question is, do we think focusing on metrics would discourage somebody with symptoms from getting a test? I sure hope not. And again, I just want to reemphasize, it's not just about that number. People really need to step back from just that number. We need to make sure we have adequate PPE across the county in all of our facilities. We don't have that. We don't have enough, certainly. We're certainly not operating with PPE like we would have been before this pandemic. I'd like to see every hospital and every first responder unit back to normal operation with PPE, not using the CDC guidelines for conserving PPE in a pandemic. So we need normal PPE. We need our hospitals to be in a place where they are using their normal beds rather than beds that have been set up in cafeterias and beds that have been set up in outpatient chemo units and all the other places where our hospitals have set up beds to help deal with this surge capacity. So our hospitals need to be back at a more normal operating procedure. So if you're somebody with symptoms and you don't get tested, you don't, if, again, and we said this in the last several weeks, if you're basically healthy and you're able to manage your symptoms at home, you don't necessarily have to be tested, but you should be isolating yourself for 14 days. And if you start to become even more sick, you absolutely should get tested so that you know what you're dealing with. So I don't think there's an easy way to game these numbers or game this system in any way. I know it's frustrating, and I know people are angry, and I know there's another set of people who are really scared. The best way to get this done and over with is for people to stay home and not try to open up their businesses on the down low, and for the businesses that are considered essential to please practice social distancing within the inside of your business. I got a photo this weekend that literally made me want to throw up. I have to just be, it like made me nauseous looking at what was going on inside of that business. And people keep asking, you know, how is it if people are social distancing that our numbers continue to be what they are? Well, that's how, folks, because not everybody's doing it. And not every business is social distancing. And we are all in this together. And the quicker everybody gets with the program, then the quicker we'll be out of this. So please, please follow these rules. They are there for a reason.
What business?
We're giving them one chance to do better. But then next week, if they do it again, I'll tell you next week.
The next question is again from Kevin Tierney. Are residents of long-term care facilities transferred to a hospital if that level of care is required, or are they treated in place? Are hospitals able to refuse long-term care patients because they have COVID-19?
No hospital, so let me go backwards. There were several questions there. So the first question was, are people from long-term care facilities who are positive transferred to hospitals or treated at the facility? Okay. So there's two categories of patients at long-term care facilities. People that have do not hospitalize orders, or maybe what's also even one step further, a do not resuscitate order. So an individual like that would not be transferred to a hospital. If an individual has a do not hospitalize order, they would not be transferred to a hospital, regardless of what happens. But for an individual who doesn't have one of those orders, and their care necessitated a higher level of care than the long-term care facility was able to provide, then they absolutely would be transferred to a hospital, and a hospital has to accept anyone like that comes in. The third part of the question was, could a long-term care facility, could a hospital refuse someone who was COVID positive. They can't refuse anybody who's COVID positive, no matter where they're coming from. I get them all? Is that all?
Yes.
Okay.
The next question is from Keith Happentreger from North Penn now. Are nursing homes included in the municipal total on the county map, or just the county total? For instance, Manor Care in Montgomery Township recently conducted a mass test of their residents, which revealed that 85 were positive. However, those 85 positives are not showing up on that township's total.
So they would show up in the town. So the question is, are the results from long-term care facilities showing up in that municipality's totals? If any resident whose permanent address is in Montgomery County, then they'll show up in our county totals. And if their permanent address is that particular long-term care facility, then they'll show up in that municipality's totals. But there's people in long-term care facilities for lots of different reasons. And some of them are only there for maybe 6 or 8 weeks of rehabbing from a joint replacement or something like that. So those people might have a different permanent address. It could be in a different county, or it could be in a different municipality in the county. So anyone who's positive, they will be counted wherever their permanent address is. So to the questioner's question, if we say that there are 85 cases, what's happening, I think, in that particular example, the facility itself released that they had a certain number of cases in that facility. Those people may not all be have permanent addresses at that facility. Anyone who did, it would show up in that municipality's count. But if they have a different permanent address, then they won't be in that municipality's count. So those numbers may not add up completely.
One final question, again from Keith Happentreger from North Penn now. What percentage of the county's positive cases and deaths have occurred in nursing homes or long-term care facilities?
So let me go back to that. I did announce that earlier. As of today, and the question was what percent of deaths. Now, I'm going to change the question. I think the question was what percent occurred in those facilities. The number, I don't know literally, I don't have the data for literally where the death occurred, but I do have the data for anyone who was in a long-term care facility at the time of their death. Their death might have occurred at a hospital, or it could have occurred at the facility. So we have 159 confirmed positive deaths of Montgomery County residents that happened in someone whose address at the time of their death was a long-term care facility, which is actually a different question. I'm answering a slightly different question that he's answering. I don't have the precise numbers of individuals who are deceased, who died in a Montgomery County long-term care facility, but whose permanent residence is not in Montgomery County. They don't show up on our death lists. So I know it's really frustrating to get a handle on these numbers, but that is the facts of how these things are reported in our state. Anything else? No? Do you have anything for me? Nope. Okay, all right. Thanks, everybody. We'll see you tomorrow.